Hello, my name is Rebecca Hodge and I am the Acting Manager of International Student Services at La Trobe University. This presentation is for new students to La Trobe University who are coming from overseas, so international students commencing with us in Semester 1, 2020. This presentation is for students who may have missed our orientation sessions, and this particular presentation is about your health, in which I will explain in brief the Australian healthcare system if you're new to the country, as well as Medibank overseas health insurance cover, how to contact Medibank OSHC and how to activate your OSHC cover and how to access health services here in Australia. So to start, just to explain that the Australian healthcare system might be a little bit different from your home country. And so as an international student new to Australia, it's important to understand which service you should access for what type of care. So when you are feeling generally unwell and you want to see a doctor for advice and medicine, in Australia you go to a doctor or what we call a GP, which is short for general practitioner. You'll often have a local medical or healthcare centre where you can make an appointment with your local doctor or GP. And many of the services there they treat for are feeling generally unwell and they can prescribe medicine for you to take. They can also provide medical letters if you might need one for a class attendance or a missed exam. If you're needing more of a specialist service, such as an X-ray or to see a physiotherapist, the doctor or GP can give you a referral to that service. So it's good to see the GP first and then they can do a referral to a specialist for you. If you are in an accident or you require emergency treatment, then you should go to the hospital in that instance. And it may be that you call 000 for an ambulance to take you there, or make your way to an emergency services yourself. Keep in mind that you do not go to the hospital if you're simply unwell, but you do go to the hospital if it is an emergency. So if it's a life-threatening or very serious injury or illness, then certainly go to the hospital. But for things that are not life-threatening or not very serious, do see your GP or doctor. So Medibank OSHC is La Trobe University's preferred provider for OSHC, and you can access them at that website. You can call them on 134148 and you can email them at oshc_support@medibank.com.au. It's a great idea to download the Medibank OSHC app, which is free from the App Store or Google Play, and that can act as your card as well, but also give you easy access to your policy and the Medibank OSHC services. For the Melbourne Bundoora campus, we do have a Medibank representative co-located with International Student Services on level 3 of the Sylvia Walton building from 10 a.m. to 4 p.m. Monday to Friday. So you can come and talk to the Medibank representative here on campus as well. So just to let you know, when you do see a doctor in Australia, it is best to see a bulk billing doctor. And what that means is a bulk billing doctor will only charge the fee that is covered for Australian citizens under the public coverage known as Medicare. So, for example, a standard medical consultation that has a bulk billed fee of $36.30, if a doctor is charging anything above that, then you will be paying for the difference, because your OSHC covers the same fee for bulk billing, which is $36.30. So for example, if a GP charges $50 for a consultation, your OSHC will cover the $36.30, but then you will have to pay the difference of $13.70. So it's really important that you look for doctors or GPs that bulk bill, and so that you don't have to pay any money up front, that only your OSHC coverage will be charged. And you can find who is a local bulk billing doctor in your area through the Medibank OSHC website and the app. So to explain a little bit more what a GP is and how they can help you. So if you're feeling unwell, you can visit your GP at the local medical centre that you have found through the Medibank OSHC app, who bulk bills, hopefully, so that you are not having to pay any money up front for that appointment. You can also access, as a Medibank OSHC member, a nurse on call, and you can speak to a nurse through the Medibank OSHC app. So they are both great services because they are free and you can contact them anytime. There are also after-hours doctors on call, and you can call 136 and you can talk to a doctor on the phone as well. Again, this is covered by your OSHC coverage and does not cost you any money out of pocket. So just to remind you, to be able to find a doctor in your area, if you simply go onto the OSHC website or the app and look for and search local GP, then it will ask what area you're living in and make suggestions of doctors who bulk bill in your area, as well as other doctors who don't bulk bill. So make sure that you are looking for those who are bulk billing so that you pay less or nothing out of pocket. If you're studying at La Trobe Bundoora campus, we do have La Trobe University Medical Centre on campus, and they are bulk billing for international students. And so if you have an appointment there, you don't have to pay any money because it will be covered by your OSHC. Once you have seen your doctor, if the doctor prescribes medication for you, you then need to go and purchase that medication from a pharmacy, also known as a chemist. There are some medicines that you can buy in Australia without a prescription from your doctor, and your doctor might simply recommend that you buy some of these medicines. But there are a lot of medicines that you do need to have a prescription from your doctor in order to purchase. So you take the prescription from the doctor, you give it to the pharmacist at the chemist, and then you purchase the medication. Now, Medibank OSHC does have coverage for some medications, and there is an annual limit as well. So you don't always have to pay for the whole cost of the medication, but it is very likely that you might have to pay a proportion of that cost of the medication. So just make sure that you keep any receipts for medication that you have purchased, and you may be able to claim some or all of that cost back. So just remember, if you are very unwell and you have an injury or an illness that is life-threatening or very, very serious, then you do need to call 000. So that's 000 for an ambulance, so that the ambulance will then take you to the hospital. And so please do not hesitate to call that number if you are in an emergency situation with your health. It's very important that you get the care that you need. And to do that, you call 000 and an ambulance will take you to the hospital for care. So do stay happy, healthy and well. I hope that you have a great time studying at La Trobe and that your health will be great. But this is important information for you to know should you need any of these services. Again, if you have any questions, you can contact La Trobe International Student Services. You can visit us at Sylvia Walton or the representative on your campus if you're studying at any campus other than Bundoora. Thank you for watching and all the best.